crafting policies to address inequality. I'm Pedro da Costa, a journalist with Market News International and a proud Wiser board member, and it's my honor to moderate today's event. We're going to be focusing on the really important but often underappreciated issue of data disaggregation and its key role for addressing inequalities of various kinds that have been highlighted by the ongoing pandemic. These include inequality in COVID-19 death, infection, and vaccination rates, gaps in labor market outcomes and financial well-being, as well as differential access to remote learning and telehealth. With that in mind, it's my pleasure to introduce today's panelists. Agnes Kissingbing is a senior research fellow at the International Food Policy Research Institute, where she's designed and fielded surveys that collect sex disaggregated data in a wide range of low and middle income countries. And she's been involved in measuring women's empowerment and evaluating the impact of gender and nutrition sensitive agricultural programs. Nicole Martin Rogers is a senior research manager at Wilder Research, a nonprofit organization based in St. Paul, Minnesota. She's a descendant of White Earth Nation and is deeply engaged in the Twin Cities American Indian community. And she uses culturally relevant research methods to address critical social issues and problems and supports government agencies, nonprofits, foundations, and community groups to use data to make better decisions. And Rhonda Fonche-Sharp is the founder and president of the Women's Institute for Science, Equity, and Race, WISER. She is the co-editor of the Review of Black Political Economy and served as past president of the National Economic Association. In 2020, Rhonda was selected to serve on the Center for American Progress's National Advisory Council on eliminating the Black-White wealth gap. And she's a vocal proponent of data disaggregation and has published many policy papers and media op-eds on the subject, as we all know. So thank you so much for joining us today, or if you're watching the recording, for tuning in that manner. So I'm going to start with a very definitional question for our panelists, which is just, if you could talk to me about what disaggregating data actually means to you, and maybe a little bit about the concept of intersectionality as well, starting with you, Agnes.
Thanks, Pedro. So let me preface my answer by saying that I come from a development economics perspective. So I have worked mostly in low and middle income countries. And most data that is collected there is collected at the household level. So when I disaggregate data, when I think about disaggregating data, I often look at looking at what's happening within the household rather than just at the level of the household. So I would collect and report data by age and sex and relationship to the household head, which is a measure of status. But I would also collect data that cuts across different households, such as caste, race, ethnicity, wealth, location, etc. Because I think a lot of these really intersect, create conditions of disadvantage for many groups within the population. Yeah, that's it. Thanks.
Thank you. And what about you, Nicole? How do you think of data disaggregation and conceptually, and how do you use it in your work?
Thanks. So yeah, as a social scientist and a sociologist, I'm interested in social groups, and data disaggregation in my world refers to splitting larger general categories into more specific groups that might be more meaningful for analysis in particular situations. So for example, when we're talking about race data disaggregation, we can break out Asian Americans into cultural groups such as Hmong, Vietnamese, Chinese, and so on. We can also group American Indians into their tribal affiliations, such as Ojibwe and Dakota, or even more specifically into their tribe or reservation that they're from, such as White Earth Nation, my tribe. And we can do this for really any major racial or ethnic group, or any large group demographic category. And in terms of intersectionality, data disaggregation can also be used to divide large groups into smaller subgroups. For example, if we're looking at the American Indian population, we can divide that group into age groups, or by gender, or by region of residence, or other things that might be relevant to understand the experience of those subgroups. And for me, that's really the critical factor is where do you disaggregate data to a level that's meaningful for the particular analysis or research question at hand, and it might be different depending on what the question is.
All right, what about you, Rhonda? How do you think about data disaggregation as a concept, and what do you want people to get out of, the things that you study?
So thank you, Pedro, and thank you both Agnes and Nicole for joining us today. I probably take approach for what both have said, thinking about household and then thinking about the smaller groups and not thinking in the aggregate, except for when the Women's Institute for Science, Equity, and Race, when we're asking people to disaggregate data, we want people to start with the outcome. Right. So, and then ask yourself, how should I disaggregate the data, thinking about the outcome? So if we're talking about an instance of wealth, what does the data, the research show us about what influences wealth? And then I would like to see people disaggregate from that perspective. So if we know that race matters, then I'd like to see it disaggregated by race. And then if we know race and gender, then to see a race and gender disaggregation. And if we know that household structure, i.e. the presence of kids, whether or not you're married, then I'd like to see a disaggregated race, gender, household structure. And often what we will see is data is reported by race or by gender, and then maybe by education, but not necessarily at the intersections of those. And so I like to say for us, disaggregation of data is the mechanics behind how we want researchers to think about the analysis, and then to use an intersectional lens to think about what are the consequences for the ways in which you've disaggregated data.
All right, thank you. And then sticking with definitions, how do you think about, in your case, Nicole, how do you think about tackling inequality, which is the subject of our talk today? And I guess, so one of the things we're going to be talking about today is what kind of inequalities are you most focused on?
Yeah, that's a big question. I think that in terms of social science, when we look at inequality, we have to look at groups in a way that understands the context. So just as an example, in Minnesota, we have a lot of Southeast Asian refugee families and communities. And we have a very large proportion of our Asian American population is refugees or second and third generation individuals who are, lived here and were born here, but their parents or their grandparents are from refugee populations. And we also have a smaller subset of Asian American folks in Minnesota that are like Chinese and Asian Indian and Korean immigrants that mostly came here to work in the professional IT market or came to work at the university. And so if we group all Asian Americans together, we have this one subgroup or several subgroups that are on the higher end of the income and education spectrum. And then we have a number of other communities where the parents or grandparents from the family might not have any formal education or might have little and come from generally lower income backgrounds, and also have very established communities here now in the Twin Cities as well. But so there's all these contextual differences that if you don't think about the disaggregation and you just think about Asian Americans as a whole, you might miss some of the educational inequities or different access to opportunities and things for different subsets in this population. Whereas if you disaggregate appropriately, looking at research questions around educational opportunities and outcomes for this population, you have to understand what some of those contextual factors are.
That's really interesting. So in other words, you could even a kind of benevolently minded social scientist might think, here I am looking at the data by race, but I'm not doing nearly enough justice, and I'm maybe skewing my outcomes by not actually paying deeper attention.
That's right. And in Minnesota, that actually is what has happened, in that in a lot of cases, when there's educational interventions that are offered, it's offered to Indigenous students, African American students, Latino students, but Asian students are often thought of as like the model minority. They might not need extra help. And so by disaggregating the data in Minnesota, there were advocacy groups that were able to show that actually there are significant subsets of the Asian American student population that does need extra help and intervention in order to have the type of educational outcomes that would be on par with other demographic groups.
That's really interesting. And what about you, Agnes? Does your focus on intra-household inequality, is that your main focus, and how does that how do you see it as being different in the developing world context than the way perhaps that we look at inequality in a US context?
So I think so. I come from a background. So I'm an economist, and most of my work has been on gender and inter-household issues, and so I tend to work a lot with stakeholders who are very interested in gender inequality. And in many cases, the assumption is often made that gender inequality is the biggest type or the worst kind of inequality in a particular society. But that assumption is not always correct, because there are some countries like mine, the Philippines, where I'm originally from, where I think wealth inequality is greater than gender inequality. It's a relatively gender egalitarian society, but the wealth inequality is really horrible. So if I were to look at policies to reduce inequality in the Philippines, I would probably target first wealth inequality before going to gender inequality. But that might not be the case, for example, in South Asia, which has greater degree of gender inequality. And I would say that a closer focus on addressing gender inequality might be more important in designing programs.
Okay. And what about you, Ron? In your case, how do you think about tackling inequality? And when you think about in the US, the racial wealth gap, do you stop in, is your first question, which one?
So that's an excellent question. Before I answer that question, I want to go back to something that both Nicole and Agnes have said, and that is about context. And I'm hoping that our audience will take that away. It's not just about disaggregating data, but it's disaggregating data in the context of what the issue that you're looking at, right? And so I think that's ultra important, right? To first think about what's the inequality that we're looking to address. As Agnes said, sometimes it's not gender, it may be wealth. And when you ask me about the US and talking about racial inequality, for me, I think the frustrating part about that is the assumption that race functions the same across racial groups. So again, Nicole has talked about how important it is to disaggregate within the Asian community so that you can see the nuances. But I think this is also true when we're talking about Blacks in the US, if we're talking about whites in the US, and then if we're talking about ethnicity, if we're talking about Hispanics, that when we disaggregate the data, it allows you to see the nuances that you don't necessarily see in the aggregate. And you and I have had this conversation before. I am waiting for the study that tells me what my wealth looks like. As a single woman who doesn't have children, I've never been married. How do I compare, not just to my white peers, but how do I compare to other women? How do I compare to other men? I want to see data aggregated and that way. The title of this webinar is hidden in the data, right? Is because when we aggregate up, it is all of those nuances that we miss, that you don't get a chance not only to see who's doing the worst, but you also don't get a chance to see who's doing well, right? And to look at what are the characteristics of the groups that are doing well and what can we learn from them and how can we structure, take some of that and then set policies around that. One of the things I would like to see that when we're talking about disaggregating data, that researchers don't come in it with a deficit lens, right? So that we're disaggregating the data so we can see the problems, right? We want you to disaggregate data so that you can see the nuances and they don't always have to be negative.
That's really interesting. Okay. And how do you see, you've already addressed this a little bit, but how do you make the concepts that you're talking about a little more concrete in terms of helping policy implementation become better, as opposed to maybe people using the notion of data disaggregation to maybe always kick the can down the road and say, oh, we need more data, we need more granularity so we can make better public policies. What are some examples where, like, where better data can really directly lead to concrete policies? And I'll open up the floor to whomever would like to speak.
So I'll take a quick stab at that. I think for the most part, most of the data that's collected by the U.S. Census, I'd argue, does that, right? It asks, I think, the appropriate questions to get at the granular analysis that we want. So I think for a lot of census data, the problem isn't the data. I think the challenge is with the researchers and how do we get researchers to be more mindful of the value first, to be mindful, and Agnes will know that one of her co-authors, Cheryl Doss, says she teaches her students that it's not about disaggregating, it's how you aggregate up, right? So, getting people to think about how they aggregate the data up to report out. I think that becomes the challenge, right? That researchers don't think about how they aggregate up the data, which is why we then ask them to disaggregate the data. And I'm not sure that many people understand the value of intersectionality, right? And that if you leave it in the aggregate, it makes it really hard to bring an intersectional lens to the conversation and context, because you're talking about these massive groups that are not a monolith. And I always find that so interesting because we hear people constantly say how groups are not a monolith. But when you look at reports, the reports will actually deliver results as if groups are a monolith. Now, having said that, there probably is also minimal value in disaggregating too granularly. So what I'd actually like to see in terms of policies, and I think what Nicole and them do at the Wilder Foundation is a prime example, is to see this more contextual, to see states think about how they need to disaggregate the reports for the policies in that particular space. And maybe not it's a situation where it's disaggregated more nationally.
Okay. What about you, Agnes or Nicole?
So I'm going to give you an example from Bangladesh, which is where I worked for a long time. One of the indicators that I've been involved in developing is the Women's Empowerment in Agriculture Index, which is a survey-based measure of women's empowerment and gender inequality, or gender equality. And this was developed by the International Food Policy Research Institute, IFPRI, where I work in cooperation with Oxford Poverty and Human Development Initiative and USAID. And they basically implemented it in the Feed the Future initiative countries. And one of the countries where it was implemented was Bangladesh, which was not unexpectedly showing very high extent of women's disempowerment and very high degrees of gender inequality. And this actually motivated the government of Bangladesh to design a nutrition-sensitive agricultural development program to try to address these gaps. And it turns out that the pilot program was so successful, which is designed around the areas of disempowerment that were identified, that the government of Bangladesh is now going to scale it up nationally. So without this very disaggregated data, the government would not have been able to identify what were the sources of disempowerment or of inequality that needed to be addressed.
Thank you. Nicole, did you want to add anything?
I would just add that in Minnesota, I mean, I'm not sure if this is exactly answering your question, but in Minnesota, we did pass legislation called Counting All Students, where I think what Rhonda was suggesting was achieved at a state level, where the state sort of came together with key communities and groups and determine what is the actual appropriate level of data disaggregation for race and ethnicity that we need in order to inform policy and funding and other things. And so they passed the Counting All Students law, which changes the level of disaggregation or the level of detail that's collected about student race and ethnicity, which I think is a good step forward.
That's really interesting. So yeah, I can even think of examples in my own reporting, to be honest, that data disaggregation would have sure helped making PPP loans more targeted during the pandemic, right? Which was a huge problem. And also reporting on the labor market, like I'd love to be able to tell more nuanced stories about what's actually happening as opposed to getting like a sort of single race, ethnicity, jobless rate, which is all you basically get on the headlines. So, I wonder.
Pedro, let me chime in on what you just said about the labor market for just a second. Yes. And that is, you know, it is one of the things that is always annoying to me because to your point about you see, well, first you can see overall, and then you can see it by gender, and then you can see, you know, white, Black, you can see Hispanic. And for those groups, they will tell you everyone, and then they'll tell you over 20. But when you come to the Asian population, it is 16 or older, and there is no gender breakout. And your comment about knowing where the PPP loans were going, right, to have better data on that. I think this is also one that in the pandemic, it would have been nice to see for the Asian population, both by gender and similar to what you get for the other groups, so that we could really see the impact of the rhetoric around the coronavirus, right? Where it started, who really was impacted. And I've mentioned this to BLS and rightfully so. They pointed out the fact that they do provide data on Asians, right? Like you can go to a separate window and create your own tables. But when you do that, it's not seasonally adjusted. Right. And what most of us are looking at to see real trends in terms of employment is to see the seasonally adjusted numbers. So sometimes it's not that the data isn't available. I would say that it isn't available equitably across all racial groups. And that's gonna have to change. I think not only as we become a more diverse society, and we are thinking about more ways in which people are marginalized, our data sets are going to have to allow us to be able to compare everyone in similar manners, so that as researchers, we can ask questions and help, I would say, more grassroots organizations put some data behind the issues that they care about. So I appreciate you bringing that up about the labor market.
No,
just
go ahead.
Just
please.
to just to add on to that a little bit is I noticed that you, and I'm not sure about this data set, but I noticed that you didn't mention American Indian populations at all. And a lot of times in population-based data sets, American Indian population is deemed too small to even be included, or they're grouped in with the other. And so that's another issue for my community in particular that comes up a lot, is just the size of the population and what's statistically significant from a population level in a statistical sense versus what's significant to our community if we're not even showing up in the data that's being used to make decisions about things.
Thank you for that, Nicole. I don't normally, right? Normally when I talk about what Wiser does, I definitely mention that in a lot of reports, especially around women. You don't hear any conversation about Asian and Native American women. So thank you for bringing that up.
And I've heard the term asterisk nation thrown around because of that issue, right? Because you show up as an asterisk in the big picture calculation. So absolutely. I was wondering if we could talk about. I'm glad you brought up the pandemic, Rhonda, because as I mentioned in the intro, it really highlights the need for like as much visibility. We talked about this at the beginning of the pandemic. Data was literally a matter of life and death, right? It was knowing like data on epidemiology, data on who was dying from what, data on, we had no knowledge at all. So it became so kind of clear the value of data at that time. But even as we exit the pandemic, I assume it's going to remain extremely relevant to know which populations have been vaccinated or not, which have gotten boosters or not, which are potentially reacting differently to COVID, for whatever reason, for whatever, and so I wonder if you guys could speak to that, and but maybe Agnes, you could talk about the difficulties in gathering data, whereas Rhonda characterized the census as kind of having it all, but maybe the researchers don't just use it. I think in developing countries, sometimes you might not have all the data.
I think the challenges in developing countries, especially during the pandemic, have led to interesting innovations, some of which may have their own biases. So, for example, there was a very strong shift towards doing phone surveys in the countries where I work because of the pandemic, the fact that it's not ethical for interviewers to be going into the community and possibly contaminating themselves. So we had really a very big pause on field work, especially for research purposes, and so we shifted to phone surveys. But we often don't realize that using a phone survey also creates its own biases, because in developing countries, it's usually men who have the phones and the women don't have the phones. And so if you're doing a survey, for example, on, say, time use, gendered time use distribution, or, for example, intimate partner violence, and if the woman does not have the phone or cannot take the call in private, you may actually be endangering her or putting her at risk. So I think there are a lot of hidden biases involved in these types of data, but in a sense we're also stuck, because if we don't use the phone surveys, then we know nothing about what's going on in real time during the pandemic. And so I think what's quite important is to be able to, of course, safeguard the data collection process, but also to take note of the possible introduction of biases. Even just asking the question, is somebody with you as you are answering this survey? And what many of my colleagues have done is to ask the question, hey, I don't hear you very well. Are you in speakerphone? And sometimes yes, and so that's a signal for you that maybe somebody is listening and the woman doesn't have privacy.
Yeah.
Yeah.
That's really interesting. Anybody else want to talk about the pandemic or kind of health-related inequities and how we might need better data there?
Yeah, one thing that I actually wrote an op-ed with a couple of my colleagues who serve the American Indian community in different public health capacities related to the COVID mortality rate in the Minnesota American Indian community. And, a lot of decisions were being made, when funds were coming down from the federal government and passed through the state and directed at different communities for COVID related resources and vaccine resources. And part of the information that was being used was the disparities in mortality and disparities in vaccine rates and stuff. And one of the things that a couple of the researchers at the University of Minnesota who I worked with discovered is that there's actual official death rate, mortality rate from COVID, which is documented from COVID cases. And even looking at that data, American Indians are slightly overrepresented in terms of mortality rate from COVID. But then there's also this excess mortality rate, which is people that have died from other causes, but may be COVID related because they couldn't get in to see a doctor, or they were afraid, or they had less access to healthcare. And the excess mortality for American Indians is far higher than other racial groups. And so that part of the disparity wasn't necessarily being considered in the decision making. Anyway, I think that, right, looking at disparity, or excuse me, data disaggregation, and also looking at it not only from the sense of the individual, but also from the sense of what are all the groups, are we counting just people that had official cause of death as COVID, or are we also counting all the other people that had excess mortality from previous years from other causes? So that is something that locally was pretty relevant for us.
That's really interesting. Thanks for that.
And I'll just chime in and say, I think for me, what has been frustrating in this space is that they have the data in most places, partly because, at least when I think about what my father's death certificate looked like, right? He was a Black male, there was information about his age. So it's always confusing to me that there isn't this intersection of the data that's being released. You can see by age, you can see by gender, you see by race, but at a national level, we don't see Black men between age, blah, 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 blah. We don't see white men. And I always thought that was so, it angered me. I was gonna say frustrating, but no, it really angered me. I think especially when we were getting data from Italy that said COVID impacted men differently than it did women. And yet, looking at the US, you really couldn't look to see what men, right? Who are these men that may be potentially dying at a higher rate from COVID than women? And I think the other part for me that I think we're going to see in the data from COVID and looking at like ACS and census data is I worry that we've lost a whole generation of grandparents, right? Just, that there's a whole generation of kids who no longer have grandparents because of how deadly COVID was for seniors. And that I really think people just sort of miss that in their reporting. And so we're gonna look and it's just gonna be like this lost generation, right? There, I can see a new headline, right? Like the grandparentless generation, or, they don't know Nana and Papa, as like literally the biological Nana and Papa. There's going to be, a good family friend who has taken that role. So for me, the frustrating part in the US is, when they have these death certificates, it really isn't that difficult to then report it at the intersection. So we could really see who was dying from COVID. And I think not just from the health, I think the health is one aspect of data from COVID that we could have used. But I think the other one is when we talked about these frontline workers.
Yeah.
Man, like, I so hate that term, essential worker, the frontline workers, because I'm always like, who are you talking about? Even in that, there needs to be disaggregation. I think for the most part, we talked about disaggregating data about race and gender, but I think it's also important for some of these larger terms like frontline workers. Who are frontline workers? As I've watched the vaccine rollout, it has been frustrating for me to see it's doctors and nurses who are being spotlighted as getting the vaccine and not cashiers, right? Who, you know, at the beginning of the pandemic, people were like, oh my God, thank you for being here so I can get groceries. How quickly it seems that faded. I would have loved to have seen the cashier as a part of this group who were the first in line to get the vaccination, right? But we didn't see that. So I think so much around COVID to me I say to folks, it has put a spotlight on so much inequality, but for me, it's also shown just how much more we need to disaggregate data, and not just by race and gender, and that we really need to think about these terms like essential workers, like disaggregate that. Tell me who these essential workers are, because I think when you do that, you'll see that some of them people really see as essential, and I've said this before, and others people see as expendable, just in the way that we actually treat them.
We also have very little visibility on how many so-called essential workers and frontline workers died. I've talked to economists who talk about this labor shortage, and some of them think that there's a labor shortage because these sectors were probably the ones where most people actually died of COVID. And so maybe a lot of these workers aren't coming back because, they're not around, sadly. So, but there's, again, very little visibility on the extent of that. I was wondering if we could go through, for each of the three of you, a kind of a wish list of data that might exist but does not, or data collection methods that could be improved upon. And maybe I'll throw in a question from Lucia Madrigal in our chat, which is, don't you think that it should be standard to add sex orientation and gender identity in surveys, which is something we haven't talked about, but seems very relevant. Who wants to take it?
I could take a stab at that specific question. I mean, I think that, gender you can ask about pretty easily, and most people are used to answering that question. It depends on how many gender options you want to provide and who your survey respondents are and how many gender options are appropriate at this point. So you have to think about that. In terms of sexual orientation, that question has a little bit more sensitivity around it. In some populations, more sensitivity than others. And so I think with that question, you really want to think about, is there a good reason to ask this question? Do we think that people's responses to the other questions on the survey might vary by their sexual orientation? And if so, is this important for us? Are we going to do something about it if we have this data? Those are all questions that I would ask myself before, as I was deciding which types of sensitive demographic questions to include. And like I said, some questions are deemed more or less sensitive than others in certain contexts. I mean, we had a survey that we were doing in a relatively conservative suburban county in the Twin Cities, where the county commissioners actually canceled the survey because we had a non-binary gender option on the survey that they didn't agree with. And so you have to really think about who your audience is and how that's going to be perceived by them, and how many categories you need to have the right nuance and meaning. I mean, if you're targeting non-binary population, if you're surveying people who are receiving services from a transgender service organization or something, you might want to have 7 different gender options listed on your survey, because for that audience, that's appropriate to get that level of nuance. So I really do think it does depend a lot on who you're surveying and what you're going to use the data for.
That's fascinating. Thank you. What about you, Rhonda or Agnes? You're muted for some reason.
I'll say yes, that we do want to have that question asked. And I think especially on census data, I'm going to out myself in that I had not thought about census data being used for civil rights. And I've been using census data since '95 as a grad student. And when someone said that to me, it was like, oh, wow, right? Like, I just used census data because it was available for me to do my research. So I think from the standpoint that census data is used for civil rights, I think that we need to have all of the questions so that you can identify protected classes, right? And so I think absolutely, and yet I agree with Nicole in terms of how do you ask that question. And I suspect that it will be a question that will evolve in the same way that the race and ethnicity questions on the census have evolved, right? You will see, you will not see a question that is encompassing, but will get you some data. And then as time goes on, that question will become better so that you can get more at the nuanced ways that people will, in those communities, are marginalized, right? And then you'll be able to do a better job in terms of intersecting that with race and other social economic factors. So I thank you for that question. And my answer to that is yes, and definitely on census and the larger federal data sets.
Agnes, did you want to chime in or?
Yeah, so I come from a somewhat different perspective because my area of work is not the United States, and we tend to design and implement our own household surveys. So in a sense, in some sense, we have some sort of privilege and be able to, in terms of being able to look at phenomena that we're interested in and then sort of going in and collecting data at the level of disaggregation that we want. That said, there are a lot of barriers from people who are actually implementing these surveys to asking questions about relationships within the household. No, you can't ask that question. And sometimes the bias is from the researcher. It's not from the people themselves. The people in some cases, like we're doing surveys on inter-household relations, people talk about them, whether they get along or not. But it's the researcher is afraid to even pose a question that could potentially, unsettle people. Yes. So I think we have to be experimental and innovative, while of course respecting, the rights of our respondents as human subjects. We do not put them at risk.
Yeah. So Rhonda, you've talked about, you mentioned capturing lone earner households in the data, it's single income households. How would that affect public policy? And you've also talked about focusing on vulnerable populations rather than race and gender specifically. Could you talk about those two issues?
I'm going to start with the latter one first, and that's the vulnerability. Sometimes I think with this work, you can be so involved that you don't realize the ways in which you're doing the things that you don't want done. And so I was presenting on the vulnerability framework. So the notion of shifting from focusing on race and gender, but to the vulnerability. So if I am concerned about a lone earner household, and generally when people think about a lone earner household, they think a single parent, but they don't necessarily think about households where there is one earner, right? And they've got dependents. For me, that house is equally vulnerable to the loss of earnings because there's only one person working, but we don't necessarily think about the household where there may be, and generally in the US, it's going to be the dad that's working and the mom that's at home. Right? We don't think about that household as being vulnerable. In fact, someone said to me, that's a privileged household, but it's only privileged as long as dad is working, because if he loses his job, what we know from economic data is it is very unlikely that the woman is going to be able to enter the labor market and recoup his earnings. So I think that I'd like to think that focusing on vulnerability gets us away from people seeing this as only benefiting one particular racial group, but that everyone can sort of see them as potentially being vulnerable. But saying that, what was brought to my attention is focusing on vulnerability is deficit-based, right? It focuses on, sort of the bad, and what we really want to do is focus on the goods that's coming out of communities. And so I was like, dang, because, as much as I talk about things being from a deficit base, I hadn't really thought about vulnerability being centering on a deficit. So rethinking, like, how do you center on a vulnerability and yet encourage people to frame their analysis in a way that isn't deficit based. And so I'm going to have to spend a little more time looking at the literature in disaster literature, because they do talk about vulnerability, and a little bit more of the health literature to see how they actually frame that. So it isn't deficit based. So thank you for that. And yeah.
That's really interesting. Thank you. We have about a little over 10 minutes left, so I wanted to ask about Biden's executive order on racial equity, because there was language in there on data disaggregation. Not every day you get an executive order on data disaggregation, so I was wondering if you could talk about the significance of it. I could read the short paragraph here, which says that many federal data sets are not disaggregated by race, ethnicity, gender, disability, income, veteran status, or other key demographic variables. This lack of data has cascading effects and impedes efforts to measure and advance equity. The first step to promoting equity in government action is to gather the data necessary to inform that effort. So how significant is that, and what might it look like?
So I'll say I was excited, right, to see that. Just because this conversation here, all of us are committed to having folks disaggregate data. Now, I think I think this is going to be the one, the proof is going to be in the pudding. So we will see how long it's going to take federal reports to do that. And what I worry about is it literally is going to disaggregate by veteran status, no intersection, right? So no, who are the veterans? Are they women, men? Again, all of the things I mentioned earlier. What are the household structures? I would have loved to have seen the word intersectionality somewhere in that, so that people understand we're not asking you to disaggregate data for the sake of disaggregating data, but we're asking you to disaggregate data so that we can use that intersectional approach, so that we can acknowledge the complexity of individuals that influence a particular outcome. But again, I'm excited to see it. I'm just waiting to see how it's going to manifest in the reports that the federal government puts out. So as I often am, I'm cautiously optimistic about the executive order.
Yeah. What about you, Nicole?
Yeah, I don't do a lot of stuff at the federal level, and so this sort of wasn't even really on my radar. I mean, when I read it, I thought that the language was good in the sense that you don't want it to be too prescriptive, because you don't want to disaggregate the same exact way in every situation, because then it's not relevant or meaningful. And so I thought it was good in the sense that it seemed like there was some language that was implying that we would do it for reasons to better understand the circumstances, which to me would imply meaningful data disaggregation. But I hope it doesn't turn into something where it turns into just, a process where now we have to ask about 15 different racial and ethnic groups instead of 5, and everyone federal government always has to do that or something, right? I mean, that's what it could turn into, and that wouldn't be helpful, I don't think.
Okay. And Agnes, is there any sort of is any document that's like this in a developing country context? Any effort to in a kind of concentrated way to disaggregate data more formally?
There is actually. The World Bank, for example, has a living status measurement study, and there is an effort now by the 50 by 2030 initiative to collect all sorts of very detailed disaggregated information in countries in agriculture. So that does exist. What actually intrigued me about the executive orders, I went and looked it up, was the question of whether agency policies create or exacerbate barriers to full and equal participation by all eligible individuals. And then there was this list of things to assess: equity with respect to race, ethnicity, religion, income, geography, gender identity, sexual orientation, and disability. This is a very potentially powerful tool if it was done properly. So I share Rhonda's view about being cautiously optimistic. I just hope, but the proof is in the pudding. Let's see.
That's really interesting. Well, thank you. And again, we have a few minutes left for any closing remarks or anything that I didn't ask about that you'd like to add.
I don't think I have any questions. I guess I'm curious to know if any of the attendees have any thoughts about something that maybe we have overlooked. As I said before, sometimes when you're doing the work, for folks on the outside, right, who are just beginning to think about disaggregating data, there are things that we take for granted in the process that others won't. So I think it would be, really helpful for all of us if any attendee has a comment or a thought to push us in our thinking.
Well, we can give them a few seconds to chime in. But... Oh, there we go. Let's see.
Maybe while we wait for the participants, Pedro and Rhonda and Agnes, I would just add something that we haven't talked about yet, is that race is a social construct. Some of these other variables, that demographic variables that we're talking about, are socially constructed. They're not necessarily something that you can take a blood test and measure someone's race. Or even measure their gender, depending on how that's defined in that social context and setting. And so since these variables are socially constructed, we can and do change the way we measure them over time. And we have to just make sure that what we measure is meaningful, both from the sense of what's independent variable that's determining the outcome, or the dependent variable, and also what's meaningful for people in that particular social context. And it's okay that changes over time, because these things are socially constructed. So especially race and ethnicity in the American context. So I just wanted to kind of highlight that.
Thanks for that. And I guess we do have one question from the audience here, which is maybe best directed at Agnes, which is about how the lack of disaggregated data differs at the national and international levels. I guess that's a pretty big question, but
I think what I would say is that the coverage and degree of disaggregation is quite spotty across all the countries in the world. There are some countries which have very good sex disaggregator and also other types of disaggregators, and there are others where it's almost like a big question mark. So it's a very unhelpful response, which is that it varies.
Yeah.
And usually by wealth.
Fair enough.
With richer countries having more sophisticated data collection apparatus.
That makes sense. Okay, well, I think we'll leave it there. I really appreciate you all taking the time and everyone who attended. And let's see, we have one last question from Jeff here. Let's see. How do you see the trade-offs between privacy and granular data? Have you encountered privacy concerns from research survey subjects? It sounds like the answer to the latter is yes, but how do you balance those two? That's a great question to end on, actually.
Yeah, I think for me, I agree. Most of the data sets that I use, if you're looking at census data, it becomes really hard to literally identify someone. Some of the data sets that I might use from NSF, you're told up front that you're not supposed to identify folks. So I think for me, Jeff, I think this is an issue for the researcher to respect the rights that they agree to, like the conditions when they get the data, not to identify folks, so that that you do respect the person's privacy.
And likewise, from the data generator or designer point of view, you don't release data which hasn't been de-identified.
All right. Okay. Thank you so much. I really appreciate everyone. It was a learning experience for me, so I hope it was the same for everyone who watched now and who watched the recording later. Thanks everyone for taking the time.
Great, thank you so
Thank you.
much.